Hi there. I see that all of you are being responsible and wearing masks. That's always nice. Let me introduce myself. I'm Stella, and I'm here to talk about nutrition. To begin with, what is nutrition? Nutrition is defined as the process of providing or obtaining the food necessary for our health and growth. Eating food that is rich in nutrients is vital for our bodies to function. These days, young people fall victim to numerous problems because of their lack of nutrition. The most commonly faced problems are heart diseases, type 2 diabetes mellitus, hair and dermal problems, obesity, weight loss, depression, anxiety, eating disorders, infertility, sleep disorders, thyroid dysfunction, and in women specifically, PCOD and breast, ovarian, and cervical cancer. Let's talk about eating disorders in a more detailed manner, shall we? Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. They might start with an obsession with food, body weight, or even body shape. In severe cases, they can cause serious health consequences and may even result in death if left untreated. Anyone can suffer from eating disorders, but they are mostly prevalent among young women. There are three major types of eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorder. Let's look at them in detail, shall we?
Hey, I am Fatima. I am 21 years old and it is my lifelong dream to be a model. I often read fashion magazines and look at pictures of other models who are skinnier than me. Looking at them, I am now insecure about my own body. I want to be as skinny as them, and so I starve myself, regardless of how hungry I am. I suffer from anorexia nervosa.
People with anorexia generally view themselves as overweight, even if they're dangerously underweight. They are considerably underweight compared to people of similar age and height. They have an intense fear of gaining weight and adopt persistent behaviors to avoid gaining weight. They relentlessly pursue thinness and have an unwillingness to maintain a healthy weight. All of this is caused because of their own abnormal body image and sometimes societal pressure to look a certain way. Individuals suffering from this disorder are typically underweight, but a person can be of normal weight and still suffer from this.
Hey, my name is Jyoti. I am 34 years old and I work as an anchor for a popular channel. As you know, to be on TV, you need to always look your best. But I can't control what I eat sometimes and I binge on food. As a result, I often induce myself to vomit after I have a meal, so that I don't put on weight from the food I have consumed. I have a fear of gaining more weight, so this is what I do to maintain my current weight. I suffer from bulimia nervosa.
People with bulimia frequently eat usually large amounts of food in a specific period of time. Each binge eating episode usually continues until the person becomes painfully full. During a binge, the person usually feels that they cannot stop eating or control how much they are eating. Binges can happen with any type of food, but most commonly occur with the foods the individual would normally avoid. Individuals with bulimia then attempt to purge to compensate for the calories consumed. Like people suffering from anorexia nervosa, people suffering from bulimia nervosa also have an abnormal body image and self-esteem that is overly influenced by body shape and weight. Side effects of bulimia may include an inflamed and sore throat, tooth decay, acid reflux, severe dehydration, and these individuals often have bite marks on their knuckles.
Hello, I'm Daniela and I'm 17 years old. I like to think I'm a good student, but sometimes I cannot handle the pressure my parents put on me to always get good grades. They have very high expectations of me and I'm worried that I won't be able to match them. I have tried talking to them about this, but they don't understand. So I turn to food. At night, I secretly go to the kitchen and binge eat whatever I can find. I'm not proud of this. In fact, I feel ashamed to talk about this, but it's the only way I know how to cope with the stress. I suffer from binge eating disorder.
Individuals who suffer from binge eating disorder typically eat unusually large amounts of food in a relatively short period of time and feel a lack of control during binges. They eat large amounts of food rapidly in secret until they are uncomfortably full despite not feeling hungry. This behavior arises from emotional stress or distress and causes feelings of shame, disgust, or guilt when reflecting back on the binge eating behavior. They do not count their calories, nor do they practice self-induced vomiting. Binge eating is used as an unhealthy coping mechanism for stress by these individuals. You might wonder, I too have binged on ice cream when I wasn't feeling particularly hungry. Do I have an eating disorder? Overeating can be a normal tendency for many individuals, such as having an extra helping at a meal even when you are already full, or eating beyond satiety at a special holiday meal or celebratory occasion. An individual with binge eating disorder has recurrent episodes of binging without purging, often leading to both emotional and physical distress. These episodes occur at least once a week for 3 months. That's how you draw the line between overeating and binge eating disorder.